In this video today, we're going to be talking about the #1 most common myth when it comes to migraines. So if you've been struggling with migraines and trying to figure out what's going on, nothing's working for you, then stick around and I'm going to get into this and all the details that you'll need to know to be able to work with your migraines in a holistic way to get to the root cause of what's going on. My name's Jenna and I am a movement and pain coach. I work with people who struggle with chronic pain and injuries to get to the root cause of what's going on for them so they can get back to doing the activities that they love to do. Please like and subscribe to the channel and let's get started. So the #1 most common myth when it comes to migraines is that it's all in your head. And I mean this metaphorically and also literally. How many of you have been told that your pain is just in your head? So this is a really common experience that people go through when they're going to a medical professional or a doctor to try to figure out what's going on. And sometimes, unfortunately, that person just doesn't have the right solutions. And so the patient is then left just feeling completely lost about what to do. So when it comes to migraines, it's often something that's just really minimized, as if it's not a really big problem, it's just a headache, and eventually it will go away. But for anyone that has really struggled with migraines, you know that that's just not true. It can be really debilitating. It can be hard to even get up out of bed or go to work or take care of the kids or just do your daily activities that you need to do in life. And that's why I wanted to make this video today, because there are some really simple things that you can do that are quite powerful when it comes to treating migraines that will help you get to the root cause of why you're experiencing these migraines in the first place. Because unlike what that myth states, migraines are not in your head. It's not a head problem. It has to do with other areas of the body, and it also may have to do with your nervous system. So let's dive into this topic a little bit more, and I'm going to give you 3 reasons why you may be experiencing these migraines, and then at the end I'm going to be talking about one of the hidden causes as to why this may be going on for you. The first reason why you may be experiencing migraines is that your neck could be out of alignment. So I have some skeletons here with me today to show you a little bit about the neck anatomy. So this is Sally the skeleton, as you may have seen in the SI joint video. She's a little hypermobile, unfortunately, and so her head just comes right off. But this is called the axis atlas. So this is the area where your cranium, your skull, basically connects to your spine, your atlas. And we want to have a nice articular surface there. We want to have good cartilage there. We want to have enough movement, but like any joint, we want not too much movement because that could create instability and create other issues. And we also want congruency. So when it comes to the joints in the body, congruency is key. That means that we have a nice articulation and everything fits together really well, because that's how the joints were designed to work. So it's very common that folks can have, we're just going to take Sally's head off for a minute. It's very common that folks can have right in this atlas vertebrae a misalignment there. And there's, entire chiropractic methods that are basically built off of adjusting just that one bone. And I'm not necessarily suggesting to go do that, but what I am referring to is that there could be a misalignment here. If that is out of alignment, then that's going to translate into your jaw and even into the bones of the skull. So we have even bones in our cranium that have a tiny bit of movement. And so if you have a misalignment there or a subluxation, then that could be causing migraines for a few different reasons. And so we'll go into that a little bit more. So what is really common is that if you have a misalignment, in that atlas vertebrae, that's going to create a misalignment then in your jaw. And having a misalignment in your jaw can cause migraines because the trigeminal nerve travels through the jaw. And the job of the trigeminal nerve is to transfer information, sensory information from the face to the brain. And so if you have a misalignment there, then that can be sending a pain signal to your brain and then causing migraines. So there are some very easy ways to bring that cervical spine back into alignment and back into balance without having to go to a chiropractor, and I will get into that in a moment. So another reason why you may be experiencing migraines is the muscles in your neck are tight. So how common is it for folks to walk around with their shoulders up in their ears? Well, that's your upper trapezius muscle. It attaches all the way into the skull. And so if that muscle's tight, then it can be causing migraines. There is also another muscle that is a suboccipital muscle. It's in the base of your skull. It's called the rectus capitis. And that muscle has fascial connections to the dura mater of your brain, which basically means if it's tight, it's going to be literally shrink wrapping your brain, and that could be causing migraines. So there are some easy ways that we can release that muscle. And at the end of this video, I'm going to be showing you some exercises and self-massage release techniques that you can do to release those tight muscles that may be contributing to or causing migraines. So let's talk a little bit about why the muscles of your neck might be so tight. And the number one reason why is posture. So if we are holding our head forward throughout the day, I think a lot of us know, okay, it's not great to do that. I shouldn't be doing that, but we're not exactly sure what it's doing to our bodies and exactly why we shouldn't be doing that and the effect that it's having. Well, it could be contributing to your migraines because if you're holding your head forward throughout the day, then that is going to create tension in these muscles in the back of the neck, and it can make the muscles either long and tight or short and tight. Another pattern we often see is the head is tilted back this way, so that's going to shorten those suboccipital muscles. We see that pattern quite commonly when it comes to kyphosis, which is where the upper back is rounding forward, an excessive curve in your thoracic spine. And so all of these things can be contributing to why these muscles might be tight in your neck and why you may be experiencing migraines as a result. But not to worry. Like I said, I'm going to show you some easy release techniques at the end. And if you just want to go straight there now, then I will put the timestamp below and you can scrub the video and watch those exercises now. Another reason why you may be experiencing migraines, especially if you are a woman, is hormonal fluctuations. So for women who have a cycle, right before that time of the month, the estrogen levels drop, and that can also trigger a migraine. So if that's happening for you, then it would be suggested to talk to your naturopath or your health provider to discuss what you could do about the estrogen levels in your body. So when it comes to supplements for migraines, it's very common that people will take magnesium. Magnesium is wonderful, and yet there are so many different forms of magnesium out there. I think there's like 5 or 6 forms of magnesium, and they all do something different. And most of them are really great for relaxing muscle tension. So if it's muscle tension that's causing your migraines, then this could be a really great option for you. So when it comes to the form of magnesium that would be best for you, it may take some experimentation, but most naturopaths suggest taking magnesium glycinate. So that could be an option for you to check out and see how that helps. But again, that's not going to work for everybody because we want to get to the root cause of what is causing these migraines. And if muscle tension is not causing the migraines for you, then that might not help. It's probably not going to hurt to take some magnesium. If you do take the wrong type of magnesium or too much of it, especially magnesium citrate, then that can cause loose stools. So you do want to be careful with that. But you want to get to the root cause of why are these migraines happening? And the number one hidden cause is stress and nervous system dysregulation. Because if our nervous system is experiencing chronic stress, or we are stuck in a fight or flight, freeze or fawn state, then the body can't do what it needs to do to heal. And also, our vagus nerve is the longest nerve in our body, and it connects to the brain. And so it can be contributing to the migraines as well. So if this is interesting to you and you want to learn more about the nervous system's role when it comes to migraines, I made a video just on this, so you can check out the link below and you can watch that video that talks more about the nervous system and how that could be contributing to migraines and what you can do to bring yourself back into balance to really help to soothe those migraines. So now I'm going to show you a self-massage technique that you can do if you are experiencing muscle tension, especially when it comes to the neck and those suboccipital muscles that we talked about before. Then I would definitely suggest trying this one out and seeing how it helps. Again, it might not be getting to the root cause of why you are experiencing this, but it's worth a shot. So what you're going to want to use for this self-massage technique are 2 tennis balls, or you could use 2 massage balls, something that looks like this, and you want to put them in a sock with a rubber band. Then we're going to go ahead and come down onto the floor so you can grab a mat and meet me on the floor. Okay, I've got my tennis balls or my massage balls in my sock, and I have a block. If you don't have a block, then you can try it without the block. I find it's easier to put the balls on a block. You might be able to use a book or something about that height that you have at home. And then I'm going to come down and I'm just going to place the balls right under the base of my skull. So I don't want to put it kind of right in the spine. I want to just find that suboccipital area. There's a little shelf there, and you'll feel the kind of soft, squishy muscles there. Those are your suboccipital muscles. And I'm just going to do a very gentle tipping of my chin up and down to massage those muscles there. And I'm going to do a gentle side to side. And you're just exploring and feeling your body. And maybe you want to stay in an area if it feels especially tight there. And as we're here, you just want to take some long, deep breaths in through the nose, out the mouth, so that we're relaxing and restoring the nervous system as we do this self-massage. And if you want to, again, find out more about the nervous system's role when it comes to migraines, I have that video you can check out in the link below. So we're just going to do this for maybe 30 seconds to a minute. And if you're feeling any pain, then of course you want to stop and rest. Just really listen to your body. Your body knows best, and it will tell you if this is too much. You can open and close the jaw a couple times. You can even make a little circle with your nose on the ceiling. Go the other way with your circle. And as you're ready, you can slowly make your way up. Okay, well, how did that feel for you? How did that go? Hopefully that helped you find some relief. So if the reason why you're experiencing migraines is jaw tension or it's coming from neck tension, then doing that self-massage should help. I'm going to teach you another self-massage technique you can do just for the jaw if the cause is coming from there. So for this one, you're just going to gently massage the muscles that have to do with the jaw. That's your masseter, and there's also the temporalis muscle. And then you also have muscles inside as well. But we're just going to be working on the outside today, which is just to slowly drag from where you feel the condyles of the joint there. We're going to drag under the jawline. You can go as gentle or as deep as it feels good. You don't want to be pushing too hard. There's some sensitive structures there. But you want to be giving yourself enough pressure to where you're feeling some sense of release. You may feel some kind of knots or some crunchies in there. And I'm dragging down because I'm also encouraging the jaw to open a little more, because with jaw tension, the jaw kind of gets compressed when we tense or when we grind our teeth or clench at night. That can really cause this kind of compression inside of the joint. And so this helps to release that and to allow for a softening there. Now we're going to try the temporalis muscle. So again, you don't want to put a lot of tension there on that muscle. That might not feel great. This time I'm dragging up towards the back of my head. Thank you so much for joining me today. I hope you found this information helpful for you. And if you would like to learn more about the nervous system's role when it comes to migraines, make sure that you click the link below and check that out. And I will see you in the next video. Take care.